okay? Because we're gonna do the least symptomatic side, or what we think is first, okay? Now, when we drop them back, we have to have their head and their neck kind of off the plinth, because we're gonna actually bring them into 30 degrees of extension and 45 degrees of rotation. So I've gotta be able to get the neck to extend. So if his head lands here, it's gonna be really hard to get extension, right? Okay, so I don't usually use a pillow for people to lay on, but the pillows can be really nice to go like this and measure how big their back is, and then kind of drop it and go, okay, would they fall off the end of the, you know, am I lined up good, okay? So pillows can be kind of nice to help gauge where your patient is supposed to be. And it happens sometimes, you don't get it right, you start to bring them back and you realize you're not gonna get back far enough. Just stop them. You know, let's sit back up for a second. I need you to scoot towards me a little bit more or whatever, okay? It's not the end of the world, but you do wanna try to get them so that you're not having to go a lot of up and down and get in a position where you know that their head is gonna drop, okay? So, I'm gonna have you go back just a couple of inches for me. Good, okay. I'm gonna raise the table up, good body mechanics, because heads get heavy. So, good body mechanics. Especially if he's got a lot of brains in there, man. That's a heavy head that he has.
I was going for rocks, but
Very nice. All right. So, we're going to look at left side first, we decided. Okay? So, we want to do a 45-degree turn to the left. Okay? So, we're going to just turn your head to the left here. Okay? On the count of 3, I'm going to just drop you back fairly quickly. Okay? I want you to try to keep your eyes open, but try not to focus on anything. And I know you might feel a little dizzy, that's okay, but try to keep your eyes open even as that happens, okay? All right, ready? Here we go, count of 3. 1, 2, 3, come on back. And boom, okay? When you're good, your stool will be right there. Ready, you grab it real quick, and I'm holding it back, keeping him still into that. He's in the extension, he's in the 45 degrees of rotation. How you doing?
pretty good.
Okay? How long do you think I should hold him here for? 30 seconds, right? It could take at least 20 seconds before his symptoms come on. So I'm looking for either symptom provocation, and then I'm going to start counting once I see it come on, right? Because we need to know if it's greater or less than 60 seconds. So you're going to want to clock somewhere where you can see it, so you can time the duration of the symptoms, okay? If my 30 seconds are up and I don't see anything, I'm good. So I'm going to go ahead and bring it back up. So it's been 30 seconds. Everything looks good. I'm looking at this eye the whole time as I'm doing it, watching to see if it's beating up or if it's beating down or if I see anything, okay? Everything looks good, so on the count of 3, we're going to go ahead and send it back up. Ready? 1, 2, 3. Back up. Boom. Now, this is where, if I sat him back up and I looked at his eyes, if they were beating down on the way down, they'd be beating up or the other way. Okay? So that's when it switches. That's every person's diagnosis that you hear about. Okay? So, if you're behind him, you're not going to see him doing that. I tend to like going from behind because then I'm ready to go into the treatment afterwards, okay? Now, if I have somebody who's a little bit more nervous, I can also do this from the front, and I'll do it on this side just because of the fact that I know the side's gonna bring the symptoms on, so I might be concerned about that. And you can still meander around to keep doing the treatments. But for some people, especially when you're first learning, like Emma, we were learning, like, is it rotating right or to the left, things like that, it's a lot easier to stand in the front because you're having to reverse everything when you're on the other side. But up and down is the same no matter which side you look at them at. So, okay, so when we go down this side, some people may have a harder time getting down, they may be worried or nervous. So sometimes you can come from the front. And the benefit of coming from the front is what you can do sometimes, and you're like, we're gonna go ahead and drop you back, so we turn your head. Now I know you're kind of a little nervous about going back and everything, so if you need to, you can put your hands on my arms and kind of hang on a little bit, and I'll help bring you back so you feel a little bit more secure. But I promise you're not gonna fall off the table or anything like that, but you're gonna feel a little dizzy sometimes, and so sometimes that can be scary, okay? Yeah. So, you might just hang on like that for me, okay? Ready? On the count, we're gonna go back, here we go, 1, 2, 3, come back, and I'm gonna go back down. I can still see his eyes, everything is still fine. You know, it's still the same test, but sometimes some patients are gonna feel more comfortable if they can have something to hang on to in front of them, okay? So, you can do it either way, just fine. Now, if this was positive, you'd be going like, oh my gosh, you know.
Oh my gosh.
Okay, so I'm looking at my watch or my clock, whatever's in front of me, I'm gonna start timing. Okay, let me know when the symptoms go away.
Oh, it's
okay?
really bad.
Okay, we're just gonna stay here, try to hang on, let me know when they go away.
How long do you want me to?
We're good.
Oh, it's great.
It's good. All right, so we settled down. Okay, I'm gonna give him probably an additional 30 seconds before I bring him up, because you don't want to be whipping people up and down after they just got dizzy, right? Because when I bring them back up, I'm probably gonna get a reversal of the crystals again, so they're gonna get dizzy again, right? So I'm usually gonna let it sit here, sit for the 30 seconds, let it kind of settle. Okay, and then we're gonna get back up. Ready? 1, 2, 3, up we go. I'm gonna bring it back up. Now, this is the time when you'd be able to see that reversal if you came back up, because you'd be able to see it from the front, okay?